Good morning and welcome from Toronto, Canada. My name is Anna Sangster from the International Federation on Aging, and it is my pleasure to be here with you today to bring the latest webinar in the WHO IFA Age-Friendly series entitled The Boom of Age-Friendly Cities and Communities in the Region of Latin America. It is a privilege this morning to be joined by Dr. Patricia Morsch, a consultant on healthy aging in the Department of Family, Health Promotion, and Life Course at PAHO's headquarters in Washington, D.C., the regional WHO office for the Americas. As Network Administrator for the WHO Global Network for Age-Friendly Cities and Communities, I've had the pleasure of working with Patricia over the past year, as she has been a crucial figure in the rapidly expanding and engaged representation from Latin America in the network. Today, Patricia will share some of the evolution, growth, and challenges in the adoption of age-friendly cities and communities in the Americas region, as well as some examples of best practice that have come forth. Now, before we kick things off, just a couple of housekeeping notes. First, the webinar recording and slides will be made available to all registrants post-webinar. And second, please ensure that all questions are submitted via the Q&A function. This allows for better coordination during the live Q&A portion of this event and for us to keep the recording of any unanswered questions. With that said, I'll turn things over to you, Patricia. The floor is yours.
Good morning, everyone. It's a pleasure to be here today with you. And first of all, I want to thank you, Anna, and the IFA for the invitation and to have this opportunity to share a little bit with you about the age-friendly cities and communities and this movement in the Americas, and especially about the boom and the increase of interest in this movement in the region of Latin America. First of all, I want to let you know that all this movement and all this interest has started in the region because the region of the Americas has always been a pioneer in elevating the agenda of health and aging. For example, the region of the Americas was the first region from WHO to have a plan on aging and health, specifically developed to aging and health. And the region is also the only one in the world that has a convention to protect older people's rights. And this is very important to highlight considering the scenario of aging in the Americas. Currently, approximately 15% of the population of the region is from older adults, population 60 plus. And this population is increasing very fast. In 2025, approximately 20% of the total population in the Americas will be older people. And at the same time that Canada and the US have already more older adults part of their population, it's important to highlight that in Latin America and the Caribbean, the increase in the older population is very fast. It's expected that the demographic transition will take place in 35 years approximately, compared to other regions in the world of developed countries that this transition happened in almost 100 years. It means that the countries from the region, and especially Latin America and the Caribbean, they have to be prepared to receive and to adequately serve this population. With this rapid demographic transition, it means that by 2030, the Americas will have more adults over 60 years old than children under 15. And as I said, it will be like faster than many places in the world. And what's important to point out is that the pace that increases the life expectancy, it's different from the pace of increasing healthy life expectancy. So people are living more, they are living more years, but it doesn't mean that they are living with better health. And there is a gap of approximately 10 years between the healthy life expectancy and life expectancy in the region of the Americas. Also, women have live longer, but they also live more years with comorbidities and with disability. So it's very important to have this consideration of the differences from gender, from regions, from age groups, and to better address older population and the aging of population in the region. But what is considered in healthy aging and to have like this successful aging process? So healthy aging, since the report published from WHO in 2015, is considered the developing and maintaining the functional ability, which will enable well-being in older age. And the functional ability comprises all the attributes related to people to be able to do and to be what they value. The functional ability, it's then all, it will be comprised by the intrinsic capacity and the environment. That said, what's influenced health in older age is the aspects on the individual, which will be the intrinsic capacity, all the mental and physical capacities an individual has. For example, the locomotion capacity, the psychological, mental vitality, hearing, vision capacity, presence of chronic conditions, but also the environment that they are at. For example, built environment since housing and the and public spaces, as well as the ability to get around through transportation, the social facilities to be able to participate in communities, and access to assistive technologies, especially if this individual has already a problem in their health, for example, a hearing aid or a need for a wheelchair and a cane, any types of these technologies. And when we think of individuals might have some losses in their intrinsic capacity or on their health, but if the environment enable them to be able to get around and to do the things they want to do and to be active and participate in the community and in society, we can still consider that they are having a healthy aging. So that's why it's so important to talk about the environment and to have actions and such movement as the global network of age-friendly cities and communities. And that's why I want to today talk a little bit about this movement in the Americas and this increase in Latin American countries, part of the global network. So the Americas are the fastest growing region in the network lately. So it's more than a half of the cities approved part of the global network from WHO is from the Americas. And there are some places that have increased the most the amount of communities and cities that are part of the network. And so I'm going to highlight the ones, and they are from Latin America: Chile, Brazil, Argentina, Costa Rica, Mexico, just some examples. And what's important to say is that in these countries, what we see is a very heterogeneous movement from all types of communities and cities that are joining the network. It's not only like very urban cities with a lot of resources that are interested in the program, but more importantly, a lot of remote areas, small communities are interested in joining the movement to have better environment for their older populations. Just to show a little bit of the scenario of the participation of cities and communities from the Americas on the global network, I want to highlight that the USA has more cities and communities and has a very strong program, and Canada too, but we can see Chile with a lot of cities that just joined. And this I want to share in the next slide about this increase in participation in those countries from Latin America. Canada was the pioneer in the region of joining the network. Since the network was established by WHO, Canada has been supportive and has been working very hard on having more and more communities part of the network. Since then, after all, the US just joined the movement. And we can see that in Latin America, actually, the movement started after 2013, 2012. And this is mostly because, or one aspect that I can highlight why this started is because, as I mentioned in the beginning, PAHO has launched this specific plan of action in aging and health in 2008. And until 2018, one of the goals was to have environments that would support healthy aging. So PAHO has started working with countries and member states to actually foster the community and and how the communities could support healthy aging and the older adult population. So this is one aspect that I can highlight. Of course, that all the demographic transition and the sense of priority that has increased coming from this demographic transition has also called attention to the need to improve the participation on the global network, or on transforming cities that are more friendly and that enable the capacities of older people. Of course, there are a lot of challenges, and from these challenges, some commitments from our office, for example, and for other organizations that are committed to support the age-friendly movement. So one of our commitments is strengthen the network, and it's not only increasing the amount of cities that are part of the network, but also giving the cities that are part of the network the support that they need to move forward with plan of action, with adaptations needed, with updating the plan of action based on the current needs of the population. One way that we are trying to do that is to increase the participation or having more affiliate members in the program. We understand and we know the importance of participation in the local level, because only in the local level that cities and communities, they know what is needed in their environment and for their population. So as long as we have a local support, cities can have can work better on improving their participation on the global network. And with this local support, we are trying to build technical capacity to support these cities and communities. We see a lot of cultural and language barriers considering the global network from countries, especially like Portuguese and Spanish speakers. And with these affiliate members or with support of other organizations that can give local build capacities and have like more close support, we think that cities and communities can have a better support on how to engage on the community and how to engage on the network, sharing best practices and being connected with other cities. We would like to develop measurable and impact indicators, and this comes from a big challenge that we have on the communities. We do have a lot of responsible engagement and interest on engaging in the movement, but due to political changes or some instability, sometimes cities have the plan, but they don't have new practices built on the new needs from older populations. They don't measure the impact of the actions that they are doing. So this is something that we would like to have, especially because we know that for the program it's very important to share best practices and to be able to reproduce things that work. So having measurable and impact indicators can support the program as a whole, and of course give strengthen the program at the local level for to increase capacity, to increase support from government and other stakeholders, because when you show the results and the impact, is easier and better to commit. And one example of this building capacity and making it easier to overcome barriers is the adaptation of the Vancouver Protocol. As you may know, the Vancouver Protocol requires different people, like with specific backgrounds, to be able to conduct the focal groups. The focal groups has to have like a number of people and representation of different groups. And sometimes in these remote areas, in these very small communities, it's very difficult to conduct the Vancouver Protocol. And the cities were reporting these difficulties. So there are some movements that I'm going to mention later on adaptations of the protocol that might help these small cities from Latin America, for example, to engage on the program easier. And actually, these adaptations, some of them came after COVID-19, because with the pandemic, it was even more difficult to be able to conduct the focal groups. So I'm going to share with you some examples based on what I just said of some cities and communities and countries from the region. So just to give some examples. In Guadalajara, Mexico, I want to highlight the example of engagement of older people, and this city as a great cross-sectional collaboration example. They do have, Guadalajara is the capital of the state of Jalisco. And in Jalisco, they actually created the state, the Jalisco Amigable con las Personas Mayores, que es age-friendly Jalisco, the whole state as an age-friendly movement. And in Guadalajara, they do have the metropolis area represented by 9 municipalities that is an age-friendly movement. And this, so they do have the support from the governor of Jalisco, but also from the mayors of each municipality, and they all work together in this movement. They do have a strategic plan for that, and they have the goal to include 7 more municipalities from this great region of Guadalajara. So this is a great example of the cross-sector collaboration. And they do that with a lot of engagement of civil society, older people specifically. And the cross-sector collaboration is extremely important due to the multidisciplinary, multi-actions phase of the age-friendly movement. In the municipality of Cartago in Costa Rica, I want to highlight all these different types of activities and actions they do have inside of the age-friendly cities and communities movement. And this, I want to highlight that because usually when we think and when we first think about an age-friendly environment, we think about the built environment and how we can make it more accessible to older people. But in fact, we have always to consider those 8 main domains of the age-friendly cities and community of the movement, and how and what's important for older people based on all this scenario. So for example, here in this municipality, they have the programs for food safety, they have social awareness and participation, they have physical activity, they have social inclusion in urban settings, and this is more related, yes, to the built environment. So it's just important to highlight that this is very important to have different actions and based on what is important for the local population. In Brazil, I would like to highlight the state of Paraná, and they have been very active in kind of in the same way as the state of Jalisco in Mexico that I just mentioned, trying to have the state as an age-friendly state. But so far, they do have at least 12 cities that are part of the global network. And all these cities, they were supported by a local university. They are all very, very small communities. and they did have the problems with language, with the Vancouver Protocol, and there was the interest, but they couldn't actually apply on the global network for the membership. So the university, as a specific project from the university, they started supporting these cities to be part of the network. They actually started with the biggest city because they would have more resources. And when they moved to the small cities, they started realizing the barriers, for example, with the Vancouver Protocol. So they made some adaptations, they have some results on research, and they are trying to build and to move forward with the age-friendly state of Paraná, again, with support of this university. And in Brazil, I also want to point out the importance of such movement and adaptations and local support, because most of the age-friendly cities and communities in Brazil are located in the south of Brazil or in southeast. And we know that maybe the most needed areas, that is the north and the northeast of Brazil, that have like maybe have a not as good life expectancy, that need more support for the aging of population, the movement has not reached those areas too. So we do need the local support to be able to expand the movement to areas that need the most. In Argentina, again, the cities have received a support, or are receiving a support from a local university as well. eSalud is working a lot on this, on supporting different cities to join the program. And during the pandemic specifically, they developed a checklist to send on WhatsApp to be able to work on adaptations on the Vancouver Protocol. And they are currently working along with HelpAge International and the University of Glasgow to support a program and develop age-friendly cities in the Andean region. And this goes along with what I was mentioning before about reaching these remote areas and like very small communities. So we do need local support that can reach these groups that are in need, but they maybe don't know and cannot navigate by themselves. In Chile, again, there is a strong support from a university, the program of Herópolis, in the University of Valparaíso. They have been supporting the program, the age-friendly cities and communities, for a long time. And they recently applied to be a collaborating center for WHO on this area of age-friendly cities and communities. And with this support, we believe that a lot of actions can be strengthened in the region on the age-friendly cities and communities. And another example that I would like to give from Chile, and I just mentioned how much they increased their participation in the age-friendly cities movement. And they do have a recently approved affiliate member in the region, in Chile. So we believe that with their interest, local interest, and local support, Chile will be still increasing a lot and having a lot of good results to share from these cities that are joining the movement. And the two examples on strengthening and giving more opportunities on the movement for older people that are coming from the University of Valparaíso, the Herópolis program, is to increase digital technologies on the age-friendly cities movement. So they are developing two different apps. One is to report specifically problems on the city that they can report to the municipality and try to give and to reach improvements. And another app is actually to coordinate and give the network to give, to listen and to find and to be able to support better vulnerable population and socially isolated older people. So they are working on these digital technologies as part of the age-friendly movement. And of course, during the pandemic, a lot of things happened and impacted older people. So I would like to share a little bit with you what we've learned from our age-friendly cities and communities. So as I mentioned, older people were the most affected during the pandemic, especially those with underlying condition, and has changed the routines and the lives of older people. And we know that age-friendly cities and communities, we do look for more participation of older people. We do want them to be able to be at the community and the society. And with COVID, it was even harder. So to try to understand the role of age-friendly cities and communities in mitigating the effects of the pandemic, we shared a survey on best practices with our focal points from age-friendly cities and communities. And we've got responses from these 6 countries, and it's like 15 municipalities. And I would like to share with you some of the examples of best practices. This is actually a published document that is available on our webpage. I'll leave the link later on. So if you want to read all the best practices and that they share and the difficulties. But I would like to highlight that in Argentina, in Vicente Lopez, they could raise a program of 1,000 volunteers to assist older adults' needs. And what is important is that this they knew already the older population, where they were, and so it was easier to access their needs and to have these volunteers established to go and assist older adults. And the same with Zarcero in Costa Rica. They did have already set up before the pandemic this program Plenitud Dorada. And with this program and this network of older people that they did already have, they could follow up with telephone and online, and the local health services could monitor the health needs of these populations. But just because that as an age-friendly city, they did already have this network set, and it was easier to reach the population. In Santiago, Chile, they developed like 2 years ago this online school program for older adults. And when they actually train older people to using technologies, and this helped a lot during the pandemic, because as older people has already knew how to manage those digital appliances, it was easier for them to navigate during the pandemic, when mostly we were like relying on digital interactions and telehealth. And also it helped the online school program, the database of participants that they did, helped to maintain communication with over 6,000 older people in the area. So the key messages that we've got from this survey was that the access to technology and having the connections with older people was very important to be able to mitigate the impacts of the pandemic. And of course, the collaboration between local actors. I mentioned before about the cross-sector collaboration, the importance of having the engagement of local actors, because they know the needs of the population. So it's easier to strengthen the program like that. But here I'm talking about the engagement of local private sectors, local civil society and community, because a lot of the programs and the actions that the cities developed relied on support of private sector or volunteers in the community to help to reach out this population and to help to move forward or change a little bit the way that they were doing, but connecting with these people that they were already serving through the age-friendly movement. And being an age-friendly city played an important role in reaching vulnerable population and helped a lot in mitigating the effects of the pandemic in these groups, because they were already, I would say, targeted by the age-friendly movement. So it was easy to keep up with them and to reach them. And of course, a significant challenge was the lack of access of technology for older populations. So as I was mentioning before, the online school in Chile helped a lot older adults, but they faced a lot of problems with communicating and having them to be able to access those technologies. And a multi-sectoral approach is very important because as I mentioned before, the participation of the private sector, the civil society is very important when we think about the whole age-friendly movement as a multi-sector and with different actions needed to achieve and the improvements on all the domains that the program actually tried to reach. And in this context of the age-friendly movement, I would like to let you know that we are that the Decade of Healthy Aging has just started, and we are launching in the region of the Americas officially in the International Day of Older Persons, so on October 1st. And this is very important because the decade means 10 years of concerted catalytic actions and collaboration that is a UN movement, but is led by WHO, trying to join different sectors, as I was mentioning right now, the importance of multi-sectoral collaboration, and with the main goal of improving the lives of older people, families, and the communities. And for that, one of the main areas of actions is actually to ensure that communities foster the abilities of older persons. And one of the main actions on this action area is the age-friendly cities and communities. So we believe that with the Decade of Healthy Aging, with joining efforts around the decade, we believe that we can strengthen even more the age-friendly cities and community movement. The Decade of Healthy Aging, to be able to work on those action areas, has like 4 main enablers, and they are all related to engaging older people. So it's something that actually is needed for the age-friendly cities and environment as well, to strengthen leadership and connect different stakeholders. So it means, again, having these multi-sectoral, cross-sectoral efforts, and drive data collection, research, and innovation. So it goes along what I said before about measuring impact and following up with the indicators to be able to understand what works, what it doesn't, and reproduce what can be done and can have good results. And one way of being engaged in the Decade of Healthy Aging is to visit and participate on the platform. The platform is a collaborative space, online space, where you can share your knowledge, you can connect with other people, so you can actually look for a specific knowledge on age-friendly cities and community. If it's your main area of interest, you can connect with other people that work with age-friendly cities and communities. So I invite you to visit the platform and to engage and be part of the movement. I also invite you to visit all the PAHOs resources. We do have a specific page for the Decade of Healthy Aging and all the activities that we are doing around the Decade of Healthy Aging. We do have some materials on COVID-19 as well. And we do have a bigger page on healthy aging with all the activities we are promoting. And on this specific healthy aging page, we are preparing and launching soon a new space for the age-friendly cities movement, which we are trying to have more information and have more of a collaborative space to connect, especially the cities from Latin America that have the cultural and language barriers to navigate on the global network. Thank you very much.
Thanks so much, Patricia. It's been truly amazing to see the growth in the last year within kind of the Latin American region, and it's so nice to kind of have a presentation that brings forward some of the innovation that's happening, because it's been very extensive, and especially through COVID, the amount of turn on a dime and kind of adaptation that we've seen is admirable. So getting into a few questions, I wanted to kick off because I know that you originally, or kind of earlier in your presentation, Patricia, talked a little bit about the Convention for the Rights of Older People and kind of that had been established in the Latin American region. Mm-hmm. And I'm wondering whether what role you think PAHO plays in kind of pushing for a UN Convention for the Rights of Older Persons, and what lessons can we learn from the establishment of that within your region?
Yeah, well, PAHOs served as a technical assistant for the development of the convention by the Organization of American States. So PAHO has been very much engaged in the region for the convention, and we've been working with countries in the region to actually ratify the convention. Right now, we have 9 countries that ratified it, and we need 1 extra country, so the convention will be actually established and put in place. There is a lot with the decade right now, and with this interagency movement globally that is coming with the decade. There is a lot of interest to have a UN, like, global convention for older adults' rights. And actually yesterday there was an event about it too, on the right of older persons and the importance of establishing a global convention. And I think this example from the region of the Americas and the convention that is already that already exists here can be a good example and to move this forward. And of course, PAHO would be very supportive with the experience gathered from the regional convention to move forward to a global one.
Thanks so much, Patricia. It's a question coming in about, rural communities and what kind of the approach is within the Latin American region for rural communities outside of these big city centers. We know there's such a kind of a juxtaposition in a way, or kind of diversity within the region of kind of, rural to urban to, suburban. So would be interested in your thoughts on kind of, how the age-friendly approach differs in a rural context.
Well, we are trying to get more and more participation of the rural areas, because this older population in rural areas, they usually need a lot of support. They do rely a lot on the community, and they do rely a lot on each other and on the really small communities services. But when they actually do need more assistance or access to different things, is very difficult for them. So with the age-friendly cities and communities, maybe they can establish different connections and have better referrals, for example, to big areas that can support them when they need it, when they need so. What we've been seeing, it's to reach these communities is very important to have support in the local area, as I was mentioning before, the examples from the university. The example from Paraná in Brazil, there is communities with less or kind of 1,000 people, and it's a fairly developed area. So they don't even have specialized doctors, physicians. They don't have this type of things in the city. They don't have a lot of different services. And so it's very difficult to them to engage in the movement on the network, for example. So having this local support from a university or from an organization is very important to help them to navigate, and actually to help them to understand the program as a whole. Because as I mentioned before, a lot of the first thoughts on age-friendly, it's on the built environment. And then when you give them a better picture that, for example, oh, the spaces for older people to, what are the activities that older people have in here? Oh, nothing, because they do their own things at home, or they do work in the agricultural things. But this is important to have and to know if this is important for them. Or in the media, is there participation of older people in there? So this type of things, sometimes in rural areas, it's kind of difficult to reach, and with support in the local level from an organization or so, it helps. And then it helps also to have better referral, and I think I can say increased visibility for the needs of this population, and to have a better support from bigger for other areas, more developed areas that can support them in case they need.
Thanks very much, Patricia. The next question we have is a little bit about kind of the cost associated and how much kind of budget of a municipality is typically spent on creating age-friendly cities and communities. And I guess, you know, a dovetail off of that question would be kind of what are some of the cost benefits of establishing age-friendly communities?
The cost associated with the movement, it would depend a lot on what's needed and what are the needs of the local population. If the older population decide they need to rearrange the whole city and to be more adapted to them, then probably it would be more costly. But if the community is saying that they have to have more activities and opportunity and green areas and opportunities to engage socially, then probably there won't be as much cost. So it would actually depend on the needs that are raised from the older population. It's important that we are working with different organizations too in low cost intervention, because sometimes a lot of the barriers that we listen is that but this would be too costly. But there are a lot of interventions that are not as costly, and with little changes it's possible to make huge changes, and changes in policy, for example. And so it depends a lot. And I do believe that cities can engage in the program and can engage on this type of, like, having a plan of action more on increasing awareness, increasing policies, and having maybe not costly interventions, but engaging in the program. I think it's already something very good. And then you can maybe, with raising awareness, it's possible maybe to raise the budget for that when we see the importance of that. So I think it would depend a lot on the reality of the place and on the things that older people think that is important to work on.
Thanks, Patricia. I think it's also, you've kind of underscored the importance of conducting those baseline assessments before establishing age-friendly cities and communities. You know, I think looking at, you know, the gaps, but more importantly, kind of the existing assets and how to leverage those effectively in an age-friendly context is important and can vastly kind of impact, you know, the budgetary expenditures. So thanks for that answer. We have a question a little bit about talking about kind of the new reality that we're facing in the context of COVID, and kind of, you know, what changes are going to need to be made kind of in the age-friendly approach to better support older persons in this new world we live in, so to speak.
Oh, a lot of changes, I think. Well,
a big question.
Yeah, I think the pandemic actually just make it clear the situation that older people are facing in our society. Nothing that happened in the pandemic, I mean, the situations regarding older people, it's not all brand new. We can see the isolation, we can see the difficulties with digital technology, we could see the ageism even before the pandemic, but it wasn't that explicit. So I think with the pandemic, it just brought to light the need and the urge to work towards healthy aging and to actually support this group. And so I think, well, the theme of the International Older Persons Day this year, it's on digital, it's equity, on equity, inclusion, and so it's on digital information. So I think this is something that the pandemic brought to light, the importance of engaging older people in this new world that we are living, that we are all connected somehow. We have access to everything so much easier through technology, and older people has to be engaged on this on this and have to have access. Also, I think ageism was very much like seen during the pandemic. And I think the discussions and the approach towards ageism would will bring some changes on the way that older people are treated or are stereotyped on the society or on health systems. And so I think the pandemic came, of course, as we are still like fighting against it and with a lot of challenges, but I think we have an opportunity, as with all the situations that we saw, not only with older people, but here focusing on older people, we have the opportunity now to make some changes based on what we saw. As I mentioned before, nothing is brand new, nothing was caused because of COVID. It was just emphasized and more explicit.
Thanks, Patricia. A question here about kind of support of age-friendly communities and the role of PAHO in supporting the creation of communities. Can you expand a little bit on kind of PAHO's role in kind of supporting age-friendly communities?
So PAHO, as the regional office in the Americas, we do support we do kind of manage the global network and the cities that are from our region. And we try to work with our country offices to give the local support for the cities and communities. And as I mentioned before, we do have some strategic partners that usually work more specifically with the country office on developing and giving the support the cities and communities need. So, but sometimes the country office asks for example, technical assistance on the platform. So we try to give them, of course, now during COVID, we do a technical meeting, virtual, with the focal points of cities and communities with our country office, and we go through the platform, what they can do there, how they can manage the information that they should be updating, and this type of thing. So we try to give, our main role is to do the technical support considering the big picture of the program. But then locally, we try to give this support through our local offices, country offices.
Great, thanks, Patricia. Kind of dovetailing off of that a little bit, can you kind of expand on the role of affiliates and the importance of having affiliates kind of embedded within the Latin American region?
Oh, yes, absolutely. So the affiliates, they would be organizations, institutions, or like the government level that will support directly the cities and communities in the local level. And they can also be, they would have like an agreement with PAHO, and they can also be supporting on the platform as well. So the affiliate members, they are very important because they can follow up with the communities, and they can be checking more constantly with the platform, like the updates that are needed, the situation of the city. One example, in PAHO, in Latin America, we do have now, let's say, over like 400 cities and communities. We are here in Washington, D.C. We don't know each city and community reality. We don't know what's going on. We cannot be checking each of them separately because the universe is too big, and the reality of each country, it's different, and each community is different. So at the local level, with the affiliate member, they can be monitoring on the platform at the same time that they know the reality of the place. So it's much easier, and they are in contact directly with us in case they need any technical support more specifically.
Okay. Thanks so much, Patricia. I have another big question for you, so don't be thrown. And I'm not sure whether kind of the question is directed at joining the age-friendly network or kind of age-friendly more generally, but kind of what are some of the hallmarks and kind of key attributes of an age-friendly city? And how do you become an age-friendly city?
Okay, yeah, this is a big one.
It is indeed.
Well, as I mentioned before, there are 8 main domains that should be considered for an age-friendly community, and they range from the built environment, but they also go through like social participation with like media, with transportation, with all the aspects that are related in a city and in the way that you can be part of the city and participate on the city. So to be able to engage on the movement or to be an age-friendly city, you should first of all understand the needs of the population, the older population, based on these main domains. So that's why I mentioned before about the Vancouver Protocol. This is the one that started the whole movement and is the investigation that is done, but there are changes right now that we are, for example, supporting to understand with older population what are their needs inside of the community. So they are gonna talk about it, they are gonna make suggestions like on the city, what should be done. And with this baseline assessment, the city can have a plan of action. So basically, to be part of the global network, you don't need to have a plan of action in advance, but you do need to have a commitment letter from the government to be able to be part of the program. And then later on, of course, you update your plan of action. And this plan of action should be updated or should have at least one new practice every year, because the population, the city changes, the population changes, and the needs change as well. So this baseline, the baseline will give the big picture to be able to have a plan of action. And then this plan of action, you will reevaluate every year, engaging other people to see, oh, this is good already, so we don't need to work on this as well, on this anymore. But this other thing is not so good. We have to keep going. There is another issue that we have to work on right now, and then we can update the plan. So basically, to be an age-friendly city and community in general is to address the needs and to engage other people, to know their needs, and to have a plan of action to engage different sectors on adapting, on working on these action areas, and having the support from the government. And then the membership, it's, as I mentioned, there are different steps, but to start with, you need the commitment and a couple of other questions to answer, like to have a focal point on the country that will manage the program and this type of thing.
Thanks, Patricia. I probably have more time for one more question, and then I'll come to you for some closing remarks. But one of the things that you just mentioned was kind of political will, the need for kind of a letter of commitment from kind of a local authority. And you kind of told earlier about Chile and the explosion we've seen in age-friendly in Chile. And I know that the First Lady of Chile was very invested in age-friendly, and that had a big play in kind of the political will in that country. Can you talk a little bit about the importance of political will, and more importantly, some strategies to sustain political will?
Yeah, the political will is very, very important. As I mentioned, right now, the letter of commitment from the mayor is one of the requirements to engage in the global network. But to move forward with the strategies, even with the topic that we were talking about before on the engagement and on the budget, is very important to have this political will. And I think one of and we do have this political will in Chile, you are right. And Chile has aging as a priority for a long time. And Chile is one of the countries that is aging faster, and with the United States and Canada, one of the countries that has like a big aging population already in the region, and not only on age-friendly cities and communities, but in other areas of older persons' health and well-being as well. But to build this prioritization on aging on the political level, I think it's one of the big strategies is to show the data and to have indicators. And that's why I was talking about that before. And that's why I was mentioning that it's one of the enablers of the decade. When you show that for example, everybody listen all the time about the aging of population and the demographic transition. But when you see numbers that the amount of older people that are going to be there and compared to young populations, and when you see the difference between healthy life expectancy and life expectancy, and you show, for example, the impact and the cost on health systems to support that those years lived with disability, then kind of the light kind of click, and you know, it's a way to try to bring this political will. So we are trying to increase those data and present data disaggregated by age. This is something else that is very important, because usually what we see on research and even like on population-based studies is the age groups, and then at the end you have a 60 plus. But if I consider the needs of a 60 plus and the 80 plus and a 90 plus, it's like very, very different. And when we show that explicitly through data, through perspectives and cost associated to it, it's a way of trying to engage the governments. But we know, like, this is a challenge we have in Latin America. There is a lot of political instability and economic instability as well right now, with the pandemic specifically. So this is a big challenge that we have to address.
Thanks very much, Patricia. So again, we're kind of approaching the hour, so I wanted to give you the opportunity to just provide some closing remarks and key takeaway messages before we wrap up for the day.
I would like to thank you a lot for the opportunity, Anna and the IFA, for organizing this webinar series. And I think it's very important to show and highlight the movement in the region of the Americas, especially how the program has been receiving attention from Latin America and the Caribbean. And I think a lot of those examples of actions and best practices and those adaptations, especially in small communities and low resource actions, can be examples and can motivate other cities and communities to join the program. And I think right now, with the decade of healthy aging, a lot of attention will be given to aging issues and to healthy aging as a whole. So I think it's a great moment to engage on the decade, to engage on the age-friendly cities and community movement, and build a society that is more inclusive, that is better for all ages. We have the focus on age-friendly cities and communities on the older adults, of course, but we always try to highlight that a society that is good for older people, it's better for everyone, because everybody's aging and everybody relates to someone that is aged. So really engaging in the movement in the decade or age-friendly cities, it's gonna build a better society for all. So thank you very much, and engage in the movement. Visit our website, and I'll be happy to assist, and I can give you my email.
Absolutely.
Thank you so much.
Thank you so much, Patricia, for your time this morning, and thank you to everybody who joined us. We look forward to seeing you next time. Have a great day.